Plastic surgery is often viewed as a female-oriented field, but Dr. Deepak Naidu in Tampa, Florida is seeing more and more males visiting his office. So thanks for having us, Dr. Naidu.
Thanks for coming over. I'm glad to talk to you guys.
Now, typically when I think of cosmetic surgery or plastic surgery, I picture female celebrities in Hollywood or whatever. I don't picture, Joe the plumber next door wanting to get procedures done. Why do you think it's become more acceptable for men to have procedures done?
I think you're starting to see different trends in the population, whereas before it was kind of a female-dominated market. Nowadays you're seeing men becoming increasingly concerned about how their appearance and how they're presenting themselves. So it may just be more of a social trend, whether it's because of profession or dating life or coming back onto the dating scene.
Well, I thought aging gracefully was something that men loved to do, a little gray, nobody really cared about. Or even if they got some crow's feet, it was to show more wisdom.
Right, yeah.
Maturity.
I think there's definitely personal preferences also. What you'll see nowadays is because the workforce is becoming younger and younger and the dating pool becoming younger and younger, there may be more of an expectation that you're allowed to start doing things and not necessarily take it as a negative. I think people in the previous 80s, 90s like that distinguished look, and now they associate youth with innovation, new ideas, new concepts.
This is especially true in the broadcast industry. With the advent of high definition, professionals on camera want to appear as youthful and energized as possible.
Why don't you tell us some of the procedures the men go through at your facility?
Okay. Well, just overall, the American Society of Plastic Surgeons compiles a list of common procedures and surgeries that are done every year. And in the course of the past 15 years, we've been seeing a rising percentage of men, up to the point now where 10% of cosmetic procedures are done on men.
In 2016, there were 14 million procedures, such as botulinum toxin or Botox, performed in office, and 1.65 million surgeries, such as facelifts, conducted.
The most common things that we're seeing is the stuff that is the least invasive. So Botox injections, chemical peels, fillers, things to make your face look a little bit more youthful and energetic.
Surgeries are less common as they are more invasive and require more time for recovery.
What type of surgeries, though? Is it more for men about like a gut or a beer belly? Sorry, I am going to go there. Or love handles?
Yeah.
Mm-hmm. Exactly.
A lot of it's facial, believe it or not. Okay. So the most common procedure for men last year was rhinoplasty. And that was followed by eyelid surgery to refresh the areas around your eyes. And then we saw other men getting things like chest reduction, somebody who is very concerned about how they look without their clothes, at the beach.
A lot of times when people have too much work done, they start to look weird.
I think the main thing is when you're looking at people, when you're talking especially, you're looking for visual cues that they're following what you're saying.
A drastic surgery will often prevent someone from being able to express those emotions through what Dr. Naidu called a mask-like face.
You lose that human component. Most people want to look like they're just aging gracefully and look natural rather than look artificial or completely made up.
And who do you think who would you say are the ideal candidates?
Typically, I would say people in their 20s to 30s. Men typically wait a little bit longer, so maybe their 30s and 40s.
Plastic surgery is more common in Florida and other warm states because people are out in the sun more and don't hide in bulky winter clothes for months at a time.
They're constantly looking at other people and looking at themselves and comparing and seeing what they think they can do to make themselves look better or, just put their best foot forward.
Dr. Naidu tells us about a client who had surgery following an impressive weight loss.
One of my clients is in his early 20s. He started after college working for an athletic association and he was almost 400 pounds. So he saw that as a motivation to lose weight on his own, diet and exercise, lost 190 pounds by himself.
That's fantastic.
Except there's often that loose skin that's still there.
Then you're left with the consequences of having that weight change. And so we actually did an abdominoplasty on him. And he looks great now. So I think people are very happy with the results and they're happy, it makes them feel better.
Plastic surgery isn't for everyone. Dr. Naidu does not recommend it for people who are expecting huge results without lifestyle changes.
There's definitely people who we'd recommend not having surgery, for example. We tell people this is for you, you're doing this for yourself, not for anyone else. This really has to be a personal decision.
Mm-hmm. Is there any sort of age restriction?
I don't think so. Again, it's mostly health related. Sometimes people are on other medications that may increase the risks, especially if you're on like blood thinners, things like that. But for the most part, most plastic surgery, especially office procedures, are accessible to everyone.
The less invasive procedures, like injectables, are preferred by most men, as they can be done before work or on a lunch break, and coworkers typically can't tell that anything had been done. So if somebody's coming in and they just want to do a very quick treatment on their face, why don't you explain some of the injectables that you'd use?
So some of the most common things we use are the botulinum toxins, which are Botox, Dysport, Xeomin. They're very popular because they help erase the appearance of lines that are already there.
Lines and wrinkles are caused by heavy muscle movement. These injections paralyze the muscle to keep it from moving, which gives time for the skin to heal.
So today I'm coming in and getting some Dysport around the eyes for laugh lines.
David Griffin is a client of Dr. Naidu. He has also previously received Dysport in his forehead and the bridge of the nose.
I used to have a pretty significant line in the middle of my brow, and that's now gone away. I also am able to get the benefit of having no more headaches on a regular basis. I used to get pretty bad headaches, and one of the things, side effects that Dysport and Botox does is it relieves the tension headaches.
David says that his motivation to get the injections lies in the theory of look well, feel well, live well.
I don't think there's as much of a stigma as there was before. I don't know of anybody that I'm around that has an issue with it. But I would imagine there might be a little bit out there, but I don't think it is as strong as it was at one point.
First, he has David smile, allowing him to see where the lines are.
Dr. Naidu injects David with Dysport.
Doing okay? Mm-hmm. So the bumps take about 30 minutes to go away. There's always a little bit of redness at the injection site. Are you feeling any pain at all?
No, it was just a little prick, but that's about it.
Okay.
Dr. Naidu applies pressure for a minute and then an ice pack. Now, is there a difference between something that would kind of paralyze muscles from working versus a filler, or are they one and the same?
So the muscle paralytics, the botulinum toxins out there, will block the muscle activity. Fillers are actually helping put volume back where something wasn't there before.
Due to sun exposure and the pull of gravity, we experience volume loss as we age.
Common areas include like your nasolabial folds, your lips, your cheekbone areas, just things that your face is normally changing, and then you're just trying to combat that a little bit more.
Some fillers are made from hyaluronic acid, which the body produces naturally. They are considered temporary and are gradually absorbed by the body, while more permanent fillers are made from synthetic materials. Was it silicone that they used to use for different injections?
Sure. So for a little while, they were using silicone in the lips. So that's permanent. So you imagine, if you implanted a silicone tube to enhance your lip profile, potentially that may eventually come out, may extrude, like we say. Right. So it seems better, especially on the face, to use something that you're not going to have to deal with 10 years from now, because you can always add more, knowing that your body's going to absorb it.
And let me just pause you there, because that's also part of why I was always in the beginning kind of against it, because to me you think botulism, that's a terrible thing. Why would I want to put that in my body?
Right, of course. And I think, the way science has evolved, we find positive benefits from different things that were discovered in the past, but now we can use it for our benefit. So what it does is help block specific muscles. It's not all over your body. It's just specific at injection sites where you're having issues.
And it's totally safe. You're not going to get sick from having botulism put in your body.
No, again, it's a very limited quantity, and for those areas, and it doesn't spread. Obviously, things can happen, but it's very, very, very rare.
So are you going to try it out?
Okay, I'll give it a shot. There you go.
Okay, look angry for me. Good, relax. Okay, we're going to get started.
I did see noticeable results within a couple of days, but I must admit I'm not likely to make injections a routine procedure, though I would recommend them to anyone who's looking to completely eliminate their lines moving forward.
Just a little uncomfortable.
You can it's just a slight little sting, and you can feel, it's almost like I can feel a little bit of the fluid.
There's a little bit of injection going in.
Not bad at all. Do what?
Look angry. Good, relax. One poke here, and then we're going to get the other side. We have just a few more injections on this side. Look angry for me again. Good, relax.
As society progresses and a more youthful appearance is desired, more and more men are choosing to pause or halt the march of time, and doctors like Deepak Naidu are there to lend a hand.
Well, thank you, Dr. Naidu. We truly appreciate you having us here and getting to meet a patient of yours and hearing great stories about the results on your other patients.
Thank you so much. I'm really excited to share that.
You can find out more by visiting Dr. Naidu's website, deepaknaidumd.com, or contact his office.
We're in Tampa Bay, but we see patients from all over. Had a lady come from Hawaii to have her surgery done here. So.
Fantastic.
And I guess don't be afraid if you're a guy. The stigma is somewhat gone nowadays, so you're allowed to look pretty.
You're allowed
I guess.
to ask questions and at least consider it. You know, it's not as much of a negative as it was in the past. And we like to make sure all of our patients are well aware of what's going on before we do anything for them.
Got it. Well, thank you.
Thank you.